Today we are going to discuss the diet that has helped millions of people worldwide reverse high blood pressure, the DASH diet. This dietary pattern was specifically designed to manage high blood pressure and is used by professionals like myself to help people prevent, manage, and reverse high blood pressure or hypertension. DASH stands for Dietary Approaches to Stop Hypertension. First, it is important that we define blood pressure and why it being high is problematic for health. Blood pressure is the force exerted by circulating blood on the walls of the arteries, the major blood vessels in the body. It is measured in millimeters of mercury and recorded with two numbers. Systolic pressure, the upper number, which indicates the pressure when the heart beats and pumps blood, and diastolic pressure, the lower number, which indicates the pressure when the heart is at rest between beats. It is important to note that both the systolic and the diastolic blood pressure are important for they are both indicators of health status. High blood pressure, also called hypertension, can lead to serious health problems including heart disease, stroke, kidney damage, and other cardiovascular conditions. Low blood pressure, also called hypotension, while less common, can also cause issues such as dizziness, fainting, and inadequate blood flow to organs. Below is a chart that shows the cutoff of blood pressure readings from normal to a hypertensive crisis. I have linked details on this chart below. As you can see, there are 5 categories of blood pressure. A normal blood pressure is the healthy recommendation. Elevated blood pressure means there is a higher risk of developing hypertension unless steps are taken to control it. Stage 1 hypertension means the disease has developed, but it is not as severe, so healthcare providers may recommend lifestyle changes and medication depending on risk. Stage 2 hypertension means it has progressed and requires medication and lifestyle adjustments to lower blood pressure. Hypertensive crisis means it is an emergency. It can lead to more health problems such as a stroke, and medical attention must be sought immediately. If this video has been insightful so far, hit the thumbs up button and subscribe. There are several causes of high blood pressure. Today we will discuss 15 of them. 1. High sodium intake. Excessive consumption of sodium or salt is a leading risk factor for hypertension. Sodium increases blood pressure by causing the body to retain fluid, which increases the volume of blood in the arteries. 2. Obesity. Being overweight or obese significantly increases the risk of developing hypertension due to increased arterial resistance and fluid retention. 3. Physical inactivity. Lack of regular physical activity contributes to weight gain and increases the risk of hypertension. 4. High alcohol consumption. Drinking excessive amounts of alcohol can raise blood pressure. 5. Diet low in potassium. Inadequate potassium intake is associated with higher blood pressure, as potassium helps balance sodium levels in the body and supports healthy blood vessel function. 6. High dietary fat intake. Diets high in saturated and trans fats can lead to atherosclerosis, which is the hardening of arteries. This contributes to elevated blood pressure. 7. Smoking. Tobacco use damages blood vessels and increases blood pressure. The nicotine in cigarettes raises blood pressure by stimulating the release of adrenaline. 8. Chronic stress. Long-term stress can contribute to hypertension. Stress leads to temporary increases in blood pressure and can promote unhealthy behaviors that exacerbate hypertension. 9. Genetics and family history. A family history of hypertension increases an individual's risk. Genetic factors can influence how the body regulates blood pressure. 10. Age. Blood pressure tends to rise with age due to increased arterial stiffness and changes in the cardiovascular system. 11. Gender. Men are generally at a higher risk of developing hypertension at a younger age compared to women. However, after menopause, women's risk of hypertension increases and may surpass that of men. 12. Sleep apnea. Obstructive sleep apnea is associated with increased blood pressure due to intermittent drops in oxygen levels and resultant stress on the cardiovascular system. 13. Chronic kidney disease. Kidney dysfunction can affect blood pressure regulation, leading to secondary hypertension. 14. Certain medications. Some medications, such as non-steroidal anti-inflammatory drugs, oral contraceptives, and decongestants, can increase blood pressure. 15. Diabetes. Diabetes, particularly when poorly controlled, is associated with an increased risk of developing hypertension due to its impact on blood vessel health and fluid balance. As you can see, diet and lifestyle choices are the leading causes of high blood pressure. Research indicates that by improving our diet and adjusting our lifestyles to incorporate healthier choices, we could lower our risk of developing high blood pressure. The DASH diet encourages the consumption of 4 to 5 servings of fruits and vegetables each per day. For fruits, one serving is typically one medium piece of fruit, such as an apple, orange, or banana, half cup of fresh, frozen, or canned fruit without added sugar, quarter cup of dried fruit, and 1 cup or 250 milliliters of fruit juice, preferably 100% juice, though whole fruit is preferred. For vegetables, one serving is typically 1 cup of raw leafy greens such as spinach and lettuce, half a cup of cooked vegetables such as steamed broccoli and carrots, raw vegetables such as bell peppers and cucumbers, and vegetable juice, about 125 milliliters. It also recommends 6 to 8 servings per day of whole grains. One serving looks like 1 slice of whole grain bread, half a cup of cooked whole grains such as brown rice, quinoa, and oatmeal, 1 ounce of whole grain cereal or pasta such as whole grain spaghetti, and half a cup of cooked whole grain pasta. For lean proteins, the recommendation is 2 or fewer servings per day, which typically looks like 3 to 4 ounces of cooked lean meat, such as chicken breast, turkey, half a cup of cooked beans or legumes, such as lentils, beans, and chickpeas, 1 egg, 1 ounce of nuts or seeds, such as almonds and sunflower seeds, and half a cup of tofu or tempeh. The recommendation is 2 to 3 servings per day of low-fat or fat-free dairy options, which looks like 250 milliliters of yogurt and milk and 1.5 ounces of low-fat or fat-free cheese, such as reduced-fat cheddar. But this might also depend on the manufacturer of the product. For nuts, seeds, and legumes, the recommendation is 4 to 5 servings per week, which could be 1 ounce of nuts, such as 24 almonds, 14 walnut halves, 1 tablespoon of seeds, such as chia seeds, flax seeds, half a cup of cooked beans, such as chickpeas, kidney beans, lentils, and peas. Limited amounts of fats and sweets are encouraged, with a focus on healthy fats like olive oil. If you are not new to this channel, then you know that the gold standard for evidence is a meta-analysis to see the overall picture and a randomized controlled trial to see the cause and effect relationship. To learn how to understand reading results from meta-analysis studies, watch the linked video shown above. Today we are going to report on 3 systematic reviews and meta-analysis on the effectiveness of the DASH diet on reducing high blood pressure, published in 2015, 2021, and 2023. The first review is by Siervo et al. And was published in the British Journal of Nutrition. They analyzed a total of 20 studies that included a total of 1917 people, with 9 studies from USA, 4 from Australia, and 3 from Iran. It included men and women aged between 31 to 60 years old. The study reported a mean reduction in systolic blood pressure of 5.2 millimeters of mercury and 2.6 millimeters of mercury for diastolic blood pressure in people with the highest adherence to the DASH diet compared to those with a low adherence. The second review by Go et al. Analyzed 10 randomized controlled trials, which included 2416 participants aged between 45 and 62 years old who had blood pressures between 127 over 81 millimeters of mercury to 165 over 85 millimeters of mercury. 4 studies were conducted in the USA and the others were from China, South Korea, Canada, Pakistan, and Brazil. The study reported a mean reduction in systolic blood pressure of 3.26 millimeters of mercury and 2.07 millimeters of mercury for diastolic blood pressure in people with the highest adherence to the DASH diet compared to those with a low adherence. Subgroup analysis showed that the reduction in systolic and diastolic blood pressure was significantly greater in people whose baseline blood pressure values were 140 over 90 millimeters of mercury or greater compared with those whose blood pressure was less than 140 over 90 millimeters of mercury. Additionally, diastolic blood pressure reduction was significantly greater in people with a BMI of 30 kilograms per square meters or greater compared to those with a BMI less than 30 kilograms per square meters. The last and most recent review is by Theodoridis et al. They analyzed a total of 12 studies, with 9 cohort studies and 3 cross-sectional studies. This analysis included over 115,000 participants aged between 36 to 61 years old. The study reported that people who had a high adherence to the DASH diet had a 17% lower risk of developing high blood pressure compared to those who had a low adherence. From the cross-sectional studies, the researchers reported 15% lower odds of developing hypertension in individuals who had a higher adherence to the DASH diet compared to those with a low adherence. They concluded that high adherence to the DASH diet has a positive effect on reducing hypertension risk compared to low adherence. These data strengthen and are totally in line with all hypertension guidelines, that is European, American, and international, independent of the cutoff points used to define hypertension, pointing out that lifestyle modification should start early before the establishment of hypertension, even in subjects with normal blood pressure levels. So, what's the takeaway here? The DASH diet isn't just another health trend, it's a scientifically proven method to lower blood pressure and improve heart health. Whether you're trying to manage hypertension, eat smarter, or just take better care of yourself, the DASH diet offers a simple yet powerful approach to making lasting changes in your life. Why not give it a try? Start today by making small manageable changes to your diet, swap out salty snacks for fresh fruits, add more vegetables to your meals, and choose whole grains over refined ones. Your heart and your future self will thank you. If you have made it this far into the video and found this information helpful, don't forget to hit that subscribe button and join our community for more tips and insights on living a healthier life. Put a salt emoji in the comments, and thank you for watching. Let's take this journey to better health together.